Welcome, welcome, welcome to the law, your money, and you. I'm Roberta Sapphire, an attorney in Sharon.
And I'm Camille Barron, a healthcare advisor and financial organizer, also in Sharon. And Roberta, I'm going to put my glasses on today because, I do have some problems sometimes seeing, especially to read. And as a matter of fact, we're going to be talking to someone today all about caring for our eyes.
Yes, and I'm going to start right in. I want to introduce Nigel Timothy, Dr. Nigel Timothy. Even though he has that young baby face, he's an ophthalmologist, and you've been around for a while.
Correct, guys. Thank you for having me.
How long have you been an ophthalmologist?
So I finished my training, my fellowship training in retinal disease in 2005. So I've been practicing now for about 13 and a half years. And in Sharon, actually in Cobb's Corner in Canton for the last almost 9 years. I started an office there in 2010, solo private practice.
Oh, that's nice. But we go all around the country. So your information is universal. And is it universal just for this area, or is this ophthalmology wherever you are?
It's universal throughout the country. We have a national certification level for this type of, from the type of practice that I provide. So basically, to become an ophthalmologist, you go to medical school first, which is 4 years of training in clinical healthcare after college. And then you do an ophthalmology residency, which has to be certified by the American Board of Graduate Medical Specialties. That's a 4-year training program. And in my case, I did an extra 2 years in retinal disease. Those fellowship years are optional. Some of us do them if we're particularly interested in certain parts of the eye. In my case, it was the retina, which is the back part of the eye, and I did an extra 2 years for that. But the rest of it is pretty much universal for the entire country.
Well, we want to know everything, especially the people out there. They don't realize they have eye problems.
Sure.
My husband once, he took an eye test, and he looked out of his right eye, and then they said, well, what do you see out of your left eye? And he said, nothing. And off he went.
That's absolutely true, guys. So what happens is that because we have two eyes, which is wonderful, one eye often makes up for the other eye. So when you just have a problem in one eye, sometimes you don't notice it. The key here is that if it's a sudden onset problem, often you can tell something just doesn't seem right. But if it's something that's more gradual, you may not notice it, and because the other eye is compensating, which is a great thing, but often when you cover one eye, that's when you truly appreciate the difference. And then you can say, hey, something's not right. One eye is much worse than the other eye, and that's probably when you should get your eyes checked for sure. Mm-hmm. And usually most people recommend at least every 2 to 5 years, depending on your age.
Mm-hmm. Well, we have a ton of questions because once we put out the word that you were going to be on, all the questions came in because people have eye problems.
Sure.
You don't realize it. But do you want to ask first? You want me
Yes,
to ask first?
I think some people don't know the difference between an ophthalmologist and an optometrist.
That's a good place to start.
That is a good question. It's actually something we get confused all the time. So the difference is an ophthalmologist is a medical eye doctor, and we specialize more in medical and surgical eye disease. So we have to go to medical school to do that, get an MD or a DO degree before you do certified training in an ophthalmology residency. Optometrists handle more primary eye care. They have an OD degree. And that's more, they do a lot more glasses and contacts, which we do also, but they do a lot of glasses and contacts fittings. Mm-hmm. And they have limited experience with eye disease also, more superficial eye disease. They have some experience with that also. They go to school for about 4 years after college, and then some of them may do an extra year.
Still.
And then they usually go into practice. We sometimes work together where they treat more of the glasses and contacts and some of the more simple eye disease that's out there. And if it's more difficult or surgical based, they refer them to us. So we do overlap a lot. They do refer to us a lot. But there is some confusion there as to who you should see for your eye care. If you have very healthy eyes and no major issues, an optometrist is often fine because they'll, treat if you need glasses, contacts, reading glasses as we get into our 40s are very commonly necessary. They can usually manage that, and often they'll check your eyes, and if they see something more serious, they'll refer you to us. Some patients come directly to us. I do a lot of patients. I mean, I see a lot of patients who, have issues with their vision and they're not really sure, and they feel more comfortable seeing a medical eye care professional, which is what I am.
It's interesting because I work in the healthcare insurance, mainly insurance, and so we have people who are getting health insurance, Medicare. A lot of people are going on to Medicare, and they will ask the question sometimes. They might have cataracts or something like that, and they get a little confused between that type of need versus vision.
Correct.
So they ask a lot of questions about vision insurance, and then they ask what's going to be covered by Medicare, say if I have to have surgery for the cataracts. So we try to explain to them that Medicare will cover the eyes in terms of health or not healthy if you have an issue, which is just what you're saying. Medicare will cover that. But if you just go to have your eyes checked for vision, then Medicare doesn't cover that particularly. And then a lot of times they end up buying vision insurance.
Is Medicare just for people over 65?
Primarily, yes.
Okay, well, what about the people who aren't there yet? Say somebody who has diabetes, diabetes can affect
Absolutely, and
the
I
vision.
specialize in that area also.
What do they do?
So yeah, those are very good questions. You're right. First of all, to answer you, Camille, first, and then we'll go to diabetes. With Medicare, you're right, they do not pay for what they call routine eye care. However, patients 65 and over often have some level of medical issue with the eyes. So a lot of them do need some level of regular medical eye care, because the percentage of cataracts in the population over 65 is, it's 95% plus.
Really?
Everyone gets a little bit of cataracts as we get older. The question is how much and whether it needs surgery, and that's the big difference.
Yeah.
Only a small percentage of patients need surgery, but it's good to get regular evaluations, usually every 1 to 2 years after the age of 65, to check for cataracts and monitor them, because we can
What
tell.
is a cataract?
That's actually a good question too. You're right. We assume sometimes
what is
everyone
a
knows
cataract?
all these terms.
We were really throwing it out to you.
No, I should have brought a nice model of the eye that I
yes.
have. I didn't.
Well, the
I didn't
next
bring it,
time.
but maybe the next
This
time.
is going to go by so fast you won't believe
I'm happy
it.
to be on again to explain some of this.
Yes.
So the eye, if you look at it as a cross section, near the front of the eye, there's a lens inside the eye, kind of like an eyeglass lens. It's a mini lens that we're born with. And it's inside the eye and it helps focus the images from the outside world onto the retina, which is like the back of the eye, and that's like a film in a camera. So that kind of takes the pictures and sends it to the brain, which is how vision works. So that that lens in the eye, as we get older, tends to get cloudy like a dirty piece of glass. And as it's almost a universal part of the aging process as we get older. It's a bit like arthritis or bone pain. All of us get a little bit as we get older. It's not part of the natural wear and tear of the human body. And so if that lens gets too cloudy, then so the cloudiness in the lens is a cataract. And if it gets too cloudy, it's impacting your vision enough, and that's subjectively determined by how well you can see, especially with night driving. You can have a lot of glare at night. You can have, your glasses just don't sharpen your vision to be able to even see well during the day. If those kind of things happen, then you can have cataract surgery, where we basically make an incision in the eye, and using an ultrasound probe, basically sound waves, we break it up and suck it out of the eye. A lot of people think it's a laser that does that. For some reason, people like to link lasers with eyes. We use the lasers in eyes a lot, especially in retinal disease. But with cataracts, right now, there's a laser cataract surgery also. I'm sorry to get a little technical.
That's
okay.
But basically, we can maybe use a laser, some cases, to cut an opening in the lens, but to suck it out, we need to use ultrasound, because it's a hard molecule, and you need
What do you
something
suck it
to
out
pulse.
with, like a mini vacuum?
Mini vacuum with an ultrasound pulse. So it's like a little jackhammer and then a mini vacuum.
What do you do with them afterwards? Are they used for
we just
experiments or
throw it
anything?
out and dispose in medical waste as to standard medical waste. It's
very
tiny.
interesting.
Yeah, that's so small.
Really?
Like the whole procedure, even injecting the fluid into the eye and sucking it out. You're talking about a few hundred cc's of fluid, and the lens
I know,
itself
and it
is
doesn't
like
take much time to do.
No, not at all.
But what about, I've heard of people who get double vision after their care. What is that from?
And that's actually an excellent question. So double vision can be very serious or it can be relatively minor. After, say, a cataract surgery, sometimes people get double vision. And if you have double vision, the most important thing you can do is cover each eye and see if the double stays or if it goes away. If the double stays, that's actually a good sign if you cover one of the eyes, because that could be, say, an eye you had cataract surgery. And that's usually the case where the eye is very dry, or there's a little bit of swelling or scar tissue or something, and it's been distorting the light that's entering the eyes. And it usually causes like a little ghost image. Like you see an image, it's not true double, but there's like a half image next to it, like a halo or a half image. We call that a ghost image. If you cover one eye, say you see two very clearly and they're side by side or one on top of the other, and you cover one eye and that goes away, that's potentially more serious, because that suggests an eye muscle movement problem, which means suggesting you had a mini stroke of the eye, of one of the eye muscles. Things that can cause that very commonly, especially as we get older, are diabetes and high blood pressure. And in most patients who have a history of diabetes and high blood pressure, say who are over 50 on average, that's usually the cause. In patients who do not have that history, the most serious causes can be an aneurysm or a brain tumor. So you want to keep that in the back of your mind whenever you talk to a patient with double vision, because the other things, if it's, say, from diabetes or blood pressure, or if it's something, say, from after surgery, that'll usually go away over time.
Oh, that's
But
good.
if it's something more serious, like a brain tumor and aneurysm, it's not the eye that's the issue, but it's that's just a sign of something more serious. The other thing with that is see if your pupils are about the same size, or if you have any droopiness in the eyelid. If your one pupil seems bigger, or there's more droopiness in the eyelid, that's also more concerning. That suggests there's something more behind.
Boy, what did they do years ago? You know,
To be honest, with this kind of stuff, this is good clinical diagnosis skills. So this is something we've been aware of for, maybe 100 plus years in terms of eye double vision. But in some of the fine points, like, cataract surgery, retinal surgery, a lot of that's only been advanced since the 1970s. So that aspect of surgical eye care is relatively new. It's within my lifetime, really, if you think about it.
And another question, because young people have eye problems
Absolutely.
too. Now, and I've noticed there's more and more, or it seems to me that there's more and more diabetes 1
Yes.
in young
that's it.
people. Do they have to worry more about their eyes?
Absolutely, yes. Getting back to the diabetes, we're going to discuss, because diabetes is becoming more common, it's actually eye problems secondary to diabetes, especially what we call diabetic retinopathy. Affects the back of the eyes primarily. It develops in about 50% of patients with diabetes.
Diabetes 1 or 2? Because 2, I think, is just diet.
Yes, diet control. And actually in both of them, but we're more concerned in type 1 patients because they develop it earlier in life. And that's actually an excellent question. After about 10 to 15 years of diabetes, a majority of patients, both with type 1 and type 2, especially after 15 years, will have some level of retinopathy in the back of the eye. The thing with type 1 patients, they can be diagnosed as a child. So they have a whole lifetime to develop this condition and potentially can get worse. One good thing about type 1 patients is often for the first 5 years after they're diagnosed with type 1, you don't see any retinopathy. So we tell patients, have an eye exam if you're type 1, usually the very young patients within 5 years of diagnosis, and then every year after that. Type 2 patients...
Can you just explain the difference?
Oh, absolutely. I apologize. So type 1 diabetes is insulin-dependent diabetes. Those patients require insulin. It's an autoimmune disease where their pancreas is not able to generate insulin. And so they need artificial insulin every day, basically to keep their blood sugars under control. It was a condition that before we developed artificial insulin, basically most people passed away from. Because without the insulin, our bodies cannot regulate blood sugar, and if it gets too high or too low, it can cause very
used to go
serious.
blind from that. I remember when I was a little kid,
and they
this
still
one went
do.
blind, or they had their toes cut off.
I
and
know.
It was
And these are
gross.
younger people, and some of them passed away. They didn't make it past 40, 50.
Wow.
And
Terrible.
Type 2 patients tend to be what we call more insulin resistant, but they're producing insulin, but it's usually later in life, it's not enough. And often they can be controlled with diet and medication. Type 2 is becoming more common because of obesity in this country. It's something, I'm dealing with my weight, a lot of us do that. And
I have a relative like that.
it's very common. We're seeing a lot of it, and it's becoming more common. And type 2 In most patients, it's considered more of partially a lifestyle disease also because of that, versus type 1 is considered essentially, we don't know what the genes are specifically, but it's considered something you're kind of genetic, autoimmune, something you have no control over.
Sure.
And so that's the big difference. And also the big difference is when you have it in life, type 1 occurs usually under the age of 30, type 2 usually most commonly over the age of 50, but they vary, both conditions.
Do they ever grow out of it, the type 1?
Unfortunately, no, they do not. And we still don't have a good way to replace insulin. They've looked at pancreatic transplants. It's getting a little bit out of my expertise, but
Oh,
we
yeah, the
tried that area.
pancreatic,
And,
that's
and
another-
so far, I think it's still, for whatever reason, it's growing the number of people with diabetes in our country.
Do you think it's
and
the
worldwide.
diet?
Partially it is, I think, the diet, in the sense that, the high carbohydrate diet, we think, and combination of that with the high fat. And that's being debated nowadays because, there's a lot of talk now whether, and this goes outside of my expertise too, but, whether if it's mostly the carbs or it's the combination of carbs with fat, because some people are saying it's the fat's not as critical without the carbohydrates. But generally that type of diet, which is
Right.
tasty, we all like it, we all enjoy it, tends to, putting on weight, tends to makes your pancreas more resistant to being able to control your blood sugar. Basically you're having to synthesize more insulin, and the body's having a harder, like more of a resistance to it, like you're kind of exhausting your supply a little bit.
It's interesting too, like your information now, people want to know. I bet you, I may be wrong, but shouldn't they have a program like this in the schools to introduce teenagers to, where they're able to understand, even from 10 years old up, well, we're going to have a visitor today, we're going to talk about your eyes. I mean, maybe it won't hit them then, but maybe they'll be more aware of it later. I don't think they have the school
I don't think
programs
so.
like that.
I don't know if they do when I was a kid, we had health and PE, and we talked about health. It was more about general health conditions. I don't know if you hit diabetes much. I know we had
Or
discussions
just
about
eyes.
AIDS and
They tell you to take care of your teeth.
Sure.
I don't even know if they do that in the
I
schools
don't know.
too. Take care of your teeth.
Yeah, you're right. Like good eye care and good, dental care. You're right. That's probably not a good idea to have. Maybe because there's not enough of us eye specialists also, maybe volunteering our time. Maybe it's our fault partially. We don't encourage it, But you're right. That's probably is a good idea. And, one good thing about eyesight is most patients, there's a couple of issues with eyes in young people. If you have diabetes, you're at high risk for developing serious eye disease as a young person. People outside of that group, eye disease is a relatively uncommon finding. And usually a lot of people develop in the eye disease, macular degeneration, diabetic retinopathy, cataracts, after the age of 50. So a lot of our patients tend to be, half of my patients are in the Medicare group, 65 and over. But that being said, there's another issues, things like glasses and contacts. People say, well, my eyes aren't good because I can't see very well. And I'm not, my vision isn't very sharp. That, if it's just the glasses or contacts, they think the eyes aren't healthy, but that's more just the focusing issue. And it's not as serious an issue because it's not about eye disease.
Well, you've mentioned macular degeneration a few times.
Yes.
What is macular degeneration?
Yes. So macular degeneration is the #1 cause of vision loss in Americans over the age of 50. It's basically a breakdown. Yeah, it's getting more and more common in a way. Partly in a good. The reason for that is because we're living longer and healthier, so there's more time for it to develop. And it's one of those conditions that is not that affected by lifestyle issues, which many healthcare conditions are. So as we live longer and healthier, unfortunately, we're still starting to develop more of it because we're living older.
Yeah.
And so macular degeneration is the tissue in the back of the eye, in the retina. If you look at the retina as a ball sideways, say, a cross section this way, the back part is the retina, and the central part of that area, our central vision, that's an area called the macula. And for some reason, as we get older, in some patients, that tissue starts to break down. The deposits form under that of basically like debris, like we call like junk. We call them drusen, and it's basically like like junk. It's like metabolic waste type constituents, and that causes that tissue to break down. The film starting to break down in the camera, and the central vision starts to go because of that. most patients have what we call the dry macular degeneration, and that's the tissues breaking down, but there's no bleeding from the vessels underneath. That's the better form to have, and it's about 90% of patients who have it, who have macular degeneration, have the dry form. But the problem with the dry form is they're not very good treatments for it. There's not much you can do to reverse it. There's some drugs in trial right now looking at it, but most have failed trials to date. And there's a couple right now that are having some promise, but it's more difficult to treat. Then there's the one thing we do for the dry form, the eye vitamins. Now you start to see those in the grocery stores and Walmart. Yep, eye vitamins.
Eye vitamins?
Eye vitamins.
I never heard of that.
It's a newer thing. They did a study. It came out in 2001. The first version is called the AREDS study, the Age-Related Eye Disease Study. And it basically showed a high dose of antioxidant vitamins. They had a special profile. And basically it includes lutein and zeaxanthin. They're like what we see in carrots. They give colored vegetables. They're colored green vegetables and carrots, and have a high concentration.
They say carrots are good for the eyes.
Yeah, and that's exactly right. So that's funny because it was based partly on old, maybe something our moms told us when we were young, and they looked at it, and it was actually true. So combining these vitamins, in carrots, it's beta carotene, which also works, but they're all similar. These what we call these luteins, these carotenoids is the right word. I have a hard time pronouncing it. But with a little bit of vitamin C, vitamin E, and a little bit of zinc in it, which that part is debated a little. But that combination reduced the progression of dry macular degeneration by about 25% over 5 years.
Boy,
it's meaningful. It's not, it's not a reversal of the disease. It didn't bring anything back, and it didn't stop at 100%, but 25% in a disease that's chronic that nothing else you can do for. It's worthwhile.
How about glaucoma?
Glaucoma is another good
well,
question,
maybe
and
that's
something it can develop in young patients and also go towards, but more common in older patients also, just over the age of 50.
The poor over age of 50.
I know.
Got to be
no,
a
it's
pill
like,
to
it's,
take
I
this
know.
and rejuvenate.
I know it's and in eye conditions, it's unfortunately, our seniors are racking up a lot of the, for the morbidity for whatever reason. But because glaucoma is also can occur as young as, people in the late teens.
You can go blind from there.
Yes,
they say.
absolutely. You can go blind from it. And rarely it's congenital. There's a different type in babies, newborns. But glaucoma is basically when the optic nerve in the back part, it's attached to the retina in the back of the eye, and it sends the signals to the brain. In glaucoma, that area gets damaged, that optic nerve gets damaged, and it's due to usually pressure building up inside the eye. We call it the silent cause of blindness. It's actually also much more common in African Americans for some reason, but I see patients with it, all different ethnic groups. And especially in African Americans, but in all patients as we get older.
Yeah, something.
Yeah, we can start losing your side. It causes you to lose your side vision first, which we don't notice. So patients often who have it, my eyes are fine. I don't notice any issues. And the problem is that tissue, that nerve tissue, you cannot reverse it once it's damaged. So what happens, it starts on the side, we don't notice it, and if it's untreated, it can creep towards the center.
Yeah.
Once it gets to that point,
You've got to be kidding, but that's a good topic.
yeah, absolutely. Once it gets to that point, there's nothing you can do. So the goal is to catch it early when it's not really bothering us and it's not visually that significant. And nowadays, a lot of, especially milder cases, most cases can be treated just with eye drops. Take once, twice, sometimes 3 times a day. And it usually keeps it at bay. So because we have a lot of good eye drops, most of which are generic, to be honest. They used to be expensive, but many are not, that are very effective still. It's actually relatively easy to treat if caught early, most patients. So we recommend, that's another reason to get your eyes periodically checked.
You are so interesting, but right at this stage we have an episode called, or a part of it's called You've Got to Be Kidding. In other words, you say something or I say something and we go, you got to be kidding. But yeah, this would be a good one for You've Got to Be Kidding. What about night blindness? You got to be kidding on that?
Driving at night is a problem for a lot of people. Why does that happen?
That's a good question. I have something somewhat related to that. So Driving at night, so a couple of reasons for that is one is cataracts as we get older affect your night driving more. So it's not so much even being able to see at night, but a lot of patients say, yeah, suddenly I'm driving
Those
the
lights.
glare.
Yeah,
the
the
oncoming
glare.
headlights are just
Maybe they
they're
should
killing
make
me.
headlights that are unglaring.
That's a
And
good.
I'm not kidding.
Yeah, that's a good question.
Kidding. You got to be
You're
kidding.
going to be kidding.
Oh, what about these yellow glasses?
Yes.
So, property manager, he
Yes.
said he bought these yellow glasses and it takes out the glare and everything and this and that.
That's actually an excellent question, and I'm not sure how well they work because I'm curious if they do. So I've looked up the literature. A patient asked me that actually about a year ago, and I looked it up. I didn't find much data in the medical ophthalmologic literature,
have
but you
to
see them
find
everywhere.
out.
Yeah,
Yeah.
and someone got it for my wife for the holidays. She got a pair of
Yellow
those and said-
glasses?
yeah, and they say it really helps with the glare, and I'm curious as to the rationale. I think maybe it blocks certain wavelengths, and the rest come through.
I don't know.
A couple of issues with that is cataracts kind of diffract light all over, so I don't know if it'll help much with that. The other issue is, I don't know, is, thankfully, in some ways, cars are getting brighter and brighter headlights, the
Yeah.
xenon lights.
And four.
Yeah, and it's great.
Four, you think you
Yeah.
got double vision with
Yeah.
the four of
Yeah,
them
right.
coming at you.
Yeah.
You
Yeah,
think it's
that's
some monster in the night.
And that's a great question.
Instead of the yellow glasses,
Yeah.
I prefer rose-colored glasses because then nothing bothers
Yeah.
you if you have rose-colored glasses on.
Well,
It's
there was
worth a
there was
try.
one time I drove over a corner of a lot,
Yeah.
and a friend says to me, "Do you have night blindness?" I go, "Yeah." Oh, because you weren't on the street.
Yeah.
Yeah.
It happens, and it's good that the cars have those bright headlights too because it helps the passengers, the driver.
Yeah.
But you're right, for the oncoming traffic, it can be, kind of a more inconvenient.
And I thought all
Yeah.
those people had their high beams on. all
Yes,
that
yes.
time.
Nowadays, like a lot
It
of these
looks
new
like
cars
high
look
beams.
like
It looks
high
like
beams or
they're
regular
high
beams.
beams.
Yep.
But it isn't.
But it isn't. It's just they're
It's the
brighter.
regular beams?
Yeah,
That's
they call it high
dangerous.
intensity.
Do you
Yeah.
notice too, a lot of towns and cities don't have lights on at the night?
Yes. That's
Especially, I have to say, especially
Yeah.
in Massachusetts.
yes, that's true.
It's unbelievable.
I mean, it's funny because we argue these things, and it's actually a great point. And then someone say, "Well, at least we're trying to save energy and global warming and things like
yeah,
what I'm saying?"
imagine the
But-
accidents.
But imagine the accident. So you're right.
You
There's
killed half
always
the
a double.
population while
Yeah.
you're trying to save the energy.
Exactly. That's exactly
Well,
right.
that's
You're right. There's no
and
clear
my
answer.
last question, because she's got to wind up, is like the diabetes and all that stuff.
Yeah.
They're making, and if you don't know, just say you don't know, stem cell therapy.
Oh, yes. It's an interesting area. They've actually had some recent studies for patients with very advanced macular degeneration
Yeah,
or damage to their macula, where they've injected some stem cells. And there's been a couple of preliminary reports in the
Really?
last few years that some patients had some improvement in vision. So it is an area we're looking at. They've been doing it for about 20 years or so, but the initial studies didn't show any meaningful changes. Some recent ones have shown that. Another thing they've looked at is in gene therapy recently, injecting genes like viruses into the eye that are specially treated. And also those might stimulate the retina, also absorb some of those genes that help you see better, that help contribute to vision, and maybe reverse some of these permanent conditions like
Boy.
advanced glaucoma, macular
You've
that
got
we
to
have
be
no
kidding.
treatments for.
We have to close.
Wow.
Would you believe that the time?
Well,
the
that's
time,
it was
the
great.
time is up. But Camille closes, and we'll have you back as a guest because you're
It's very
fascinating.
interesting.
Absolutely.
Our activity books are,
Oh, I
are
love that.
the
Yeah.
LAPD, Los Angeles Police Department, has asked us to do a book for them, and we're so
that's great.
excited. And I think we have to go.
Okay. Well, thank you so much. This has been, not to use a pun, but
Yeah,
very
come on
eye-opening.
over.
Very eye-opening to
Thank-
learn all of this.
Thank you. I
This
appreciate you
is
guys
his
having
mini-me,
This is
mini-me
my
Evan.
mini-me,
He's
mini-me
going to
Evan, my
close
first
with
son.
us.
That's
We're gonna-
right.
We're going to get him to work.
Absolutely.
The
a
law, your
pleasure.
money, and you. Go.
So I want to ask our viewers to please let us know if you have questions about health of the eyes or anything else. Please let us know. And as always, remember, this is your show. The law, your money, and
And
you.
you.